American singer-songwriter Billy Joel is canceling all of his scheduled concert stops. The singer says he was recently diagnosed with a brain disorder called normal pressure hydrocephalus. The 76-year-old is undergoing physical therapy and has been advised to not perform as he recovers. Joel says that he's sorry to disappoint his audience and thanked his fans for understanding in a statement posted to Instagram. So to help us understand what this all really means, we're joined by Dr. Gregory Luciano. He's a neurosurgeon and director of the Hydrocephalus and Cerebral Fluid Center at Johns Hopkins University. Doctor, you specialize in treating normal pressure hydrocephalus disease. Can you, just for those of us who don't know, explain to us what it is?
Sure, yes, of course, and thank you for having me. Normal pressure hydrocephalus afflicts people generally in their 60s and later. And it shows up as problems in walking, some problems in memory, and sometimes problems in bladder control. But it's called hydrocephalus because it means that fluid builds up in your head, specifically inside your brain, and starts to compress the brain and cause the problem.
And so how common is this?
Well, it's not as common as stroke or cardiac disease. However, it's believed to be about 5 to 10% of those who present with problems in dementia or problems in walking, and maybe as many as 500 to estimated 700,000 people in the United States. I think every neurologist and neurosurgeon has seen cases of NPH.
You mentioned some of the symptoms off the top, but what should people be watching for?
Well, as we get older, almost all of us have some problems. We slow down in our walking. We may have more problems in memory and so forth. So sometimes it's insidious and it happens gradually. But if you or a loved one seems to be slowing down faster over the course of a year and it's unexplained, then it's possible that it could be other things such as vascular problems with blood flow to the brain. But this normal pressure hydrocephalus is something that could be diagnosed basically through those symptoms, but also with the addition of an image of the brain, of a CT scan.
So somebody who is diagnosed with this, what's the prognosis moving forward? It can be treated?
Well, that's the important thing I think about, as opposed to other forms of dementia. This is treatable. I mean, with a surgical procedure, this is almost reversible, not entirely in all cases, but significantly in many cases, many as 80% of the cases. It's treated with a surgery called shunting. It's cerebral fluid or CSF shunting. And what it involves is placing a catheter into the brain, into the center of the brain where there is a collection of fluid called the ventricle or the ventricles. That catheter then drains not all the fluid, but a portion of the fluid, so if you will, the overflow, and drains it through a tube that goes down behind the ear, over the collarbone, and actually usually empties into the belly in the area around the intestines. And it's in there at all times. No one can see it. It's all under the skin. And many people, you may pass people in the street that have a shunt and you would never know it because it's all inside. And it regulates the amount of fluid that it drains, but it's draining a little bit all the time from your brain.
Doctor, what you're describing sounds very complicated. It's good to know that it can be treated, but what's the recovery time? Because Billy Joel has not only apologized to fans, he said that he looks forward to returning to the stage. And I'm wondering, in your opinion, how likely is that to happen? How long might it take?
Yeah, that's a difficult question. Of course, everybody is different. It depends on how severe they are, how long they've had the symptoms. But generally speaking, you can see some improvements within weeks or months. We see people that continue to improve over months after the surgery. And things like physical therapy and activity and reactivating the body and regaining balance skills is something that takes a matter of months. But there can be a significant recovery that can get a person back to many of the tasks they were doing before.
Dr. Gregory Luciano, director of the Hydrocephalus and Cerebral Fluid Center at Johns Hopkins University. Thank you so much, Doctor.
Thank you.